It is our privilege today to have Amrita here. Echoing Healthy Aging has been in this space for many, many years, and it's an organization that is dedicated to providing qualitative life for dementia patients and their family. Their work is well known across India, and it gives us so much happiness to have Amrita here. This session will be co hosted by Sarthi Ajita, and Ajita ma'am will be the one who will be doing this webinar in the form of a conversation with Amrita. But please, for all the participants in the webinar, this is an interactive session. Do share your comments, feedback, questions, and let's make it as interactive as possible. With this session, we are kicking off awareness on cognitive health. So for the whole of this week and next, we will be undertaking many activities on Sukoon, just in the spirit of understanding cognitive health better. Over to you, Amrita and Ajita ma'am.
Thank you, Vibha. And it's a pleasure to be here. And thank you, Amrita, for taking the initiative and joining us here to, like Vibha said, to empower us. It's really wonderful that you're here. And I will start off with a very, why dementia? Why do we need to discuss dementia? How is it relevant for us? If you could say that. We start off with that. And
First of all, thank you, Ajita ji. Yes, you can go ahead if you want to give
yeah,
more
I'll
instructions.
just a small message to our audience. Please put in your queries and doubts in the chat box. We will be discussing all your questions. Please feel free to also wait till the end and personally ask Amrita any doubt that you may have. But it would help if you would, as we go along, put in your questions in the chat box. Thank you so much. Yes, over to you, Amrita.
Thank you,
Why
Ajita ji.
dementia?
Yeah, I mean, before we get into the session, I just wanted to say something if I can.
Yes, sure.
First of all, thank you very much, Vibha, for inviting me here. I'm very impressed with the work you have been doing. Like you just started this year, and very impressive to see you're covering many different topics that are relevant to seniors. So I congratulate the entire team of Sukoon Love for taking this initiative. And of course, Ajita ji and Divya, who have been constantly working on this program. A lot of work goes behind these events. So I'm sure all the audience do appreciate that, Sukoon Love is taking those efforts. So September is in fact the Alzheimer's month. It's called as Alzheimer's Awareness Month. 21st September is the Alzheimer's Day. And every year they have a different theme. This year the theme is No Dementia, No Alzheimer's. That's one of the reasons we have many events, and one of the events we have partnered with Sukoon Love to spread that awareness. So yes, I'm happy to take question, Ajita ji, and from the audience as well.
Yeah. So thank you for updating us on this date, very important date. And we often hear of dementia, Amrita, but more popularly, we hear of Alzheimer's. Is it the same thing, or is it? Could you elaborate on the difference between dementia and Alzheimer's?
Sure. So before I start, I actually had a very quick question for everyone. So the first question is, do you know about dementia? Do you know about dementia, right? So I don't know if there is any way if they can maybe say in the chat or just raise the hand. Anything is okay. I'm very curious.
Yeah. Here there is Sudha who says, I tend to forget small things, go blank sometimes with names, etc. So,
I will address that little later. Definitely, I'll address that question.
Anyone else who would like to speak at this point? Amrita wants to know if you have any awareness or any personal experience with dementia. You can
I'd
unmute
say
and
even if you're not able to answer in the chat or by unmuting, just ask that question to yourself. Do I know about dementia, right? And then the second question was, do you know someone with dementia, right? So one part is knowing about the disease. I'm aware
yeah.
that this is some sort of disease. It has so and so symptoms. And second one is, do you know someone with dementia? So why I asked that question is very interestingly because for majority of my work was done in England, in UK, and there was a lot of stats available, and very interestingly, every fifth person you see on the street, you see in the school, in the college, anywhere, knew someone with dementia, right? And if you know someone with dementia, you of course know about the disease already. I'm not sure how the awareness is overall in India in terms of stats. We don't have that, but definitely it's much better than how it was a decade ago. So the commonly asked question, rightly, Ajita ji, is what is Alzheimer's, what is dementia? They say. So just to give you very simply, dementia, look at it as the umbrella term, right? And in that, there are different types or causes that cause dementia, and one of them is Alzheimer's. So when I say Alzheimer's is actually a subset of dementia, right? Then there is another very commonly seen in India, the type is vascular dementia, right? So it's about the vascular factor related to lifestyle disease. There is Lewy body dementia, there is frontotemporal dementia. So in that way, there are like many causes of dementia. So it's an umbrella term for the symptoms like forgetfulness, mood changes, behavioral symptoms like repetitive behavior, saying same thing again and again, or doing same action again and again, anxiety, agitation, again, very commonly seen. One interesting symptom, I would say, of dementia is actually apathy. Apathy means not having any interest on like if they want, they have been doing certain activities maybe 5 years back, 10 years back, now they have completely lost interest, right? So it's not just the forgetfulness, there are many symptoms that actually signify the term dementia. So yeah, in simpler word, Alzheimer's is the most common cause of dementia, and in India I would say vascular dementia is on the rise because it's related to vascular factors.
So, could you tell us a little more about the symptoms of vascular dementia?
So
Dementia,
symptoms,
yeah.
yeah, symptoms more or less are same.
Hmm.
Like if I were to give you example in frontotemporal dementia, we see a lot of behavioral symptoms like hallucinations are very common. Whereas say in Alzheimer's disease, it is kind of considered as someone very linear kind of dementia. So a person with dementia can actually live up to, on an average, 10 to 12 years, right? So when I say average, which means it can be lesser and it can be even as high as 30 years, right? And we have seen those cases. We run a dementia support group since past 7 years. At this moment, sadly, any type of dementia is incurable. So it cannot be cured. There is no treatment that can arrest the progression, right? Or stop it. And to kind of make it more complicated, it is also progressive, which means it gets worse over time, right? So from early stage and moderate and advanced stage, etc. That's the nature of the dementia as a disease.
Okay. So you spoke about the symptoms, and you also said that there is no cure, and it gets, the disease gets progressive over the years. Is there, and you said there is no external factor that will arrest the disease, but is there anything that you can do to manage the situation? To, whatever the negative aspects of it may be.
Correct. So that's in fact the very right way of putting it, and that it can be managed. The disease can be managed.
Hmm.
So the focus always is on slowing down the progression,
Hmm.
right? So once we have someone who is diagnosed with dementia, the support that we provide them is how we can slow down the progression, right? So be it using some pharmacological intervention or non-pharmacological intervention. Then it basically means you are keeping that person with dementia in earlier stages as long as possible. So when they are more dependent, they are still active. There might be forgetfulness, there might be certain other symptoms like judgment is impaired, there are behavioral symptoms, but at least in early stages, they still can process a lot of information. So typically, when we talk about forgetting things, right, it's not like they're forgetting everything. It's a short-term memory loss that's more prominent. So what do you mean when I say short-term memory? So short-term memory loss signifies something that happened today, something that happened yesterday, 2, 3 days back. You met someone you forgot. You forgot the name of someone you met 2, 3 days back. What you ate in the morning, you have forgotten. But if you talk to them about 20 years back, 30 years back, what happened in their life, their old native, their hometown, their wedding, their family members, especially parents, they will remember those things very clearly, and that's what probably confuses everyone, right? So the memory seems sharp, so it cannot be the dementia, it cannot be the other types of dementia. So the short term memory loss is more prominent, but as the disease progresses, eventually long term memory is also affected.
Okay. So, is there any, you spoke about the time frame. Does it differ from person to person? Uh, and I said, like, to manage. How do you manage the person? Is there a regular schedule that we follow? Or how do we manage these things? Because my mother has the beginning stages of dementia, and like you rightly said, she remembers all her, distant past, but what she ate this morning probably she doesn't remember, but she otherwise seems sharp. So why I'm asking you this question is, how can I not make her more uncomfortable with the situation, in the current situation, and is there anything I can do in terms of physical activity or following a regular schedule that will help alleviate this problem?
Sure. So yeah, when it comes to dementia, there is no straightforward way to predict that when someone will get into the next stage, and it's extremely slow progression. Okay, so there are certain other diseases that have symptoms like dementia, right? And that's one of the reason why it's always recommended when you see certain symptoms that you feel could be the dementia, could be a type of Alzheimer's, a type of vascular dementia. We highly recommend you go see a medical professional who specializes in diagnosis. Why? Because if there are any reversible factors that are causing the memory loss, see, memory loss is not just because of dementia. It can be due to a urinary infection. It can be due to certain vitamin deficiency. It can be even due to depression, right? So a lot of these factors are actually can be treated and you can get better. So what we highly recommend is never self-diagnose the disease as it is just because you're forgetting something. Second part is if you are diagnosed with the dementia, or if your loved one is diagnosed with dementia, then the focus becomes that how do we maintain the quality of life, right? So quality of life means they are happy, they're enjoying their routine, whatever they are doing, they're engaged in that activity. You can only achieve these things if you stop focusing on everything they can't do, right? Whatever their weaknesses are, if we keep on focusing on that my parent is forgetting a lot of things, so I need to just work on her memory. Probably that's not the strategy we recommend. In fact, we recommend if she likes art, if she likes singing music, if she likes maybe attending a Sukoon Love like of group sessions, let her attend. She may not process in like totally 100%, but whatever she can absorb, it gives her quality of life. We definitely recommend, right? So this advice, in fact, is not just for the dementia per se, but for all of us. Is there is a concept called cognitive reserve. Okay. So very interesting story first I'll give you because I was always amazed by it. So there is a study called Nun study, right? A study that was done in the US. And what was it about that very old nuns? They were actually studied that how their IQ was, how their quality of life was, right? And there was one nun who consistently was scoring really well, right? And she passed away at the age of some 101 years, right? Now, after she passed away, her brain was analyzed, right? So, when they analyzed, they actually saw that whatever is required to have the disease of dementia, that pathology was present in her brain.
Okay.
But she somehow was fighting it, right? So, the interesting question was, how did she do that? She has the age factor. I think there was one question someone asked in the chat, when does it start? So there is one research which actually says that dementia could start even 25 years back before it gets diagnosed. So if someone is diagnosed, say at the age of 80, probably the pathologies of that was had started forming 25 years, right? So those cognitive reserves are the way your brain fights these diseases. So how do we strengthen our brain, right? So this is a bit off topic, but I still think I'll just add two, three things here. So cognitive reserve can be built by variety of activities. What is important here is variety, right? If you say I do Sudoku every day, well and good, but there has to be variety. If you're doing Sudoku, start doing word search. If you're doing words, start doing some art activity. If you're doing art activity, start learning something new. Learning something new always gives you good strength to find a lot of these diseases. Very important factor always has been the physical exercise, right? So any type of exercise that you like, cardio exercise, strength training, yoga, Zumba, you doing that regularly actually sharpens your brain. And third important part, which you're actually kind of doing it right now through this session, is being socially engaged, right? So I'm sure you will have certain events where in a group they get to engage or they get to even engage one to one, I think, with Sathis, right?
Yes.
So that social stimulation is extremely important. So loneliness, in fact, is said to be one of the risk factors for dementia. Right? Depression is said to be one of the risk factor for dementia. So doing variety of things actually will strengthen your brain as a muscle, which works on the fact use it or lose it. So more you kind of use the brain, different variety of activities, occupational activity, especially if you're retired, the best thing to do is maybe looking after your grandkids, right? It's like once you get up in the morning, you have something to look forward to. So that sense of purpose is very important. That gives you occupation. If you look after the house, if you have some other duties or maybe sathis, right? They have very interesting concept where the
Conversation.
seniors actually have that occupation. So
Yes.
more than the person you're helping, it is actually helping sathis as well, right? So, similarly, it applies to people with dementia as well. Even if when they are diagnosed, variety of activities, when they do it, it helps their brain. So, one of the reason why we have a lot of our team visiting them at homes doing the brain exercises is because that helps them slow down the progression. We also do group sessions for the same reason that there is a social stimulation and the therapeutic activities. So yeah, I think my answer went a bit longer,
No.
but
Perfect.
that's how the cognitive reserves, the strength of brain actually helps.
Yeah. So I like the fact that you emphasize that, even though we have retired, we continue to learn new things, to explore different opportunities, and to activate different parts of our brain with different kinds of activities. That's very relevant. And someone asked, is there when do we diagnose? There is this age related or normal kind of memory loss, and then there is the onset of dementia. Is there any test that we can take to kind of identify the onset of this?
Right. So the dementia actually is noticed by, I would say, the people around you.
Hmm.
Okay. So, say if your spouse has some issues with the memory, it's the say wife or the husband will kind of recognize, okay, something is not right. So you forgetting your key, you forgetting your mobile, you forgetting a person you just met their names. It's okay, right? Nothing to worry about that. What you should worry about is if you forget certain things, but even when you are given clues, you are reminded about that, you don't recollect, right? So suppose this event happened, maybe a lot of people will forget my name, what the event was about. But if Ajita ji, you meet someone, you tell them, listen, I was facilitating that, maybe you are more familiar for them. Vibha meets them, Divya meets them, and then they recognize, yes, yes, I remember now. So then that means you're okay.
Okay.
But even with lot of clues, you have absolutely no idea when that event happened, what happened. You routinely kind of put key in the fridge, food in your clothes cupboard, right? These things are not okay. And these you won't realize, but your family members around you will realize. And they ideally should then contact the neurologist, psychiatrist, or geriatrician. These three are recommended as someone who can diagnose. Don't go to a family physician, right? So we have very nice set of family doctors we have always had, but you need a specialist doctor here. Now, there is interestingly a stage before dementia, which is called as mild cognitive impairment. So, what happens in mild cognitive impairment is they say in that stage, probably a lot could be done to kind of, in a way, delay the onset either of dementia or you can even reverse it. Right?
Okay.
So that initial impairment stages are very good to get diagnosis of. If most of you are in Bangalore, I think Nimans has a very good setup when it comes to that. There will be some private doctors.
What is the speciality that? So you suggested Nimhans in Bangalore.
Because I've done certain sessions with them, I know there are many good
Mm.
doctors. I can even send names later, right?
Mm.
But there, even in all private hospitals, now the geriatric clinics are mandatory, even in the big hospitals, right? So ideally, whatever is nearby you, you can contact them. To repeat again, the psychiatrist, neurologist, and geriatrician. Geriatricians are the doctors who focus on the elderly's medical care, right? So these three are ideal doctors to kind of reach out. Yeah.
Yeah. So maybe you can, at the end of the session, put some of your recommendations in the chat box so that it will
Yeah.
help our viewers, uh,
Yeah.
the geriatrics or the specialized areas that we're talking about. And yeah, you did talk about how to keep our brains active and healthy. So is this hereditary? Is my next question. And because my mother has it, do you think that, I mean, should I be alarmed and should I be waiting for it to happen to me? What I mean is it hereditary?
Right. So, yes, I mean, there is a risk of that hereditary factor, but it's not the 100%, right? So, if you go into the science, there are certain combinations of ApoE4 gene that you require to actually certainly have that indication that you will have dementia. The biggest factor still remains the age.
Mm.
So as your age is increasing, the chances of you getting any type of dementia increases. Uh, in UK, the early onset was considered before 65. So anyone who got diagnosed before 65, that was considered as early onset of dementia, not very common. After 65, it was late onset, so someone who is elderly. And someone who was 80, their chances were much higher. Someone who was 90, 100, their chances were much, much higher, right? So age was the biggest factor, but still it never is a normal part of aging. So someone at age of 65 might get it, and someone who is at age of 80 will not have it. right? So it's not a normal part of aging, it what we need to do. So all the work we do is purely evidence based, which means whatever I talk to you about is supported by the science, right? So there is regularly the Lancet research always produces risk factors which are for dementia. And very interestingly, Ajitaji, if you can see, there is one factor, the big dark blue is
Mm.
actually the hereditary factor, right?
Oh, okay.
So that's something you can't modify. And like I said, we always focus on the strengths and not on the weaknesses. So that factor is something is not a lot could be done to modify right now. Right
Mm.
now, of course, science is changing. Maybe things will change later. But there are other factors that are actually related to lifestyle,
Mm.
which are totally with you. You can work on.
Yes.
So, especially around midlife and late life, I think that's something is relevant to most of the attendees here.
Mm.
So, again, something interesting, hearing loss. If you're not able to hear very well, has a contribution that actually increases the risk of you getting dementia. So, a simple treatment for that is getting your hearing checked and getting whatever modification is required in this. Hypertension, obesity, these things you can totally work on. They are in your hand. In late life, so we are talking something about around 60 plus. If you are still smoking, if you stop that, right? One risk factor is kind of taken care of. Depression, if you feel you have some mental health problems, you feel that you are not able to take certain if there are like depression like symptoms, right? So you need to get them clinically diagnosed, you get the treatment, and you kind of reduce the risk factor. Physical inactivity, so that's something we addressed some time back. They in fact said that even 15-20 minutes of walk can actually significantly reduce your risk of dementia, right? Social isolation. So if you're isolated, lonely, a United Nation with whom we closely work, they actually released a data which was very disturbing. They said that 1 in 3 senior citizen actually feel experiencing the isolation or loneliness, right? So you need to kind of have your family, friends, people like Sukoon Love in your network, right? To kind of address that. Diabetes, all these are like, something you can control. And I highly recommend you focus on that, right? There are ways to even have the genetic studies where you can actually assess your risk from the hereditary factor. So if you're curious, again, you can check in the local hospital, is that available? Our recommendation is focus on the lifestyle factors.
Lifestyle. Yes. I think that I would also recommend that all of us focus on our lifestyle. And Sukoon Unlimited has unlimited opportunities to change your lifestyle. We have Sukoon Sartis who will be talking to you on a one-to-one basis and provide joy and happiness and build your self-esteem. Then there are Sukoon experts who will solve all your problems, whether it's legal or financial. And then we have Sukoon challenges. We have walking challenges, we have jogging challenges. So even if you are not inclined to walk, there is a challenge thrown to you in a group, and as a group it's fun doing it. So please explore all these opportunities which are being provided to you by Sukoon Unlimited. So thank you, Amrita, for that very valuable insight on changing our lifestyle, which will probably help us control and delay the onset of dementia. Also, to keep, I think I liked your idea of keeping, mentally active by doing a variety of things, learning new things. So, learning music, learning singing, learning an instrument, all this is something I think I am going to do now.
So yeah, since you're on that topic, probably I don't want to miss one more interesting study is so that was actually a very large sample, so it's very significant. So again, back in the US, they took a sample of close to 1,000 people, and they did a long-term study, which means they started observing people from their early 40s till they were in their 70s and so on. So then there was one group. So how it always works in research is they have one sample which does something and another sample which does something else. So that one sample was given, they used computers, they used to solve the Sudoku, they were socially active, and the other sample was not doing so many things. So what they saw was, of course, the sample which was doing a lot of these activities, the diagnosis of even mild cognitive impairment was negligible in those. But what was interesting is the once they had reached in their senior years, so 65, 70 around, what was in fact more beneficial. So they said that computer, if you're using from 40s, 50s, is really beneficial. A lot of these activities, if you're doing from early on, is beneficial, but it was art activity. It was art activity when you start doing in senior years, it gives you benefits then and there, right? So art therapy, again, highly recommended. Lot of my clients come to us saying, listen, Amrita, my dad, maybe he'll not like art. So like, listen, don't worry. We have good variety. There is origami, there are like art projects. And some of the male clients that we have, they do really well.
You did mention that there are no medicines, but I think there is some kind of medication given to severe cases, right? So
So, there is medication. It's very important. In fact, this medication help you slow down the progression.
Mhm.
So you right now the research says is you need both. You need the medical intervention as well as the activities we talked about. So just working with one definitely is not recommended. You need both combination. Again, something very interesting in Canada, the psychiatrists are actually prescribing these classes, especially if people have mental health issues, right? So someone who has mental health issue, the psychiatrist will give them medicine and they will also say, listen, join a music class, listen, join a swimming class, right? So they need to work together, right? Hence, my always the first advice is see a doctor, a professional who deals in this dementia care, neurological issues, even mental health issues, right? And also have these other alternative therapies to kind of to help you slow down the progression or help you build the cognitive reserve if you're not into the dementia spectrum. So yes, the medications are available and there are different variety available. So best would be you take medical advice.
yeah, so thank you so much. At this point, I'll request audience to please ask questions.
Can I ask one or two questions?
Yes, please go ahead.
It's been a wonderful session. I have really learned a lot of things. And by keeping ourselves engaged at 60 plus age, we will definitely try to overcome. But my question has been already answered in this session. Sometimes when I play badminton, after probably a month, I forget where I kept the badminton racket. So now these questions have been answered by the speaker very well. And I'm already keeping a lot of other activities like gardening, painting, exercise, feeding birds, spending time on spiritual activities. Trying to keep myself occupied. But the session has been very, very uh, interesting and lots of learning. Thank you, Sukoon Unlimited, for doing a wonderful job.
So Sudha Single says, I tend to forget small things, go blank about events and names. Am I having dementia? So
Sudhaji, all of us. I think we all have those moments. So I'd like to repeat, usually a person who has dementia, they don't have awareness that they are forgetting. So if you're forgetting and you're remembering that you're forgetting, it's a good news. Um, but yeah, I mean, if you have any doubts, right, feel free to maybe contact a professional nearby you. rather than having that worry always. It's always better to kind of get anything sorted. Is it really the vitamin deficiency, then your blood work will show that the doctors can give you some vitamins which can actually correct this issue. Urinary tract infection, again, if someone has long stay hospitalization, sometimes they also have this acute confusion as well. So ideally, no, if you're forgetting small things, no, you can use some ways to remember. See, every person has different memory. Have a very good routine. One thing I would like to, in fact, use this platform is to talk to caregivers. There is a high likelihood that some of you who are here is caring for someone who has cognitive impairment. And it becomes extremely important, hence, that you look after yourself first, that your mental health, your physical health is taken care of. Maybe this platform I would also like to use to address the seniors as well, that you can very well be the dementia champion, right? Which means you having the awareness about the disease. If there are people around you who are living with the disease, there are caregivers who are taking care of them, you can support them. Caregiving is a very extremely lonely journey. They routinely say that we feel isolated, we feel no one understands us. They feel the burnout, they feel the stress of caregiving. Most of them are seniors like you because they're caring for their spouse. Hence, it's extremely important that you're aware about who is around you, your friend, family, or even the Sukoon Love family, friends, like that network. Very important not to just focus on the person with dementia, but also the family members, their caregivers as well.
Yeah, thank you, Amrita, for setting that clock right for the caregivers. Vishnu Swarup says we are told that consuming coconut oil prevents dementia. Is it true?
Um, to be frank, there hasn't been any evidence per se. So it's very kind of dangerous to assume
Yeah.
that this is a miracle treatment. Um, so if it was, everyone would do it. It might have some benefits, but per se, there is no evidence that it has stopped the progression of dementia or it has cured someone with dementia. But maybe if it has different benefits, yeah, you can very well maybe study some research and check how it benefits. Because I was also told there can be certain disadvantages as well of consuming the oil, right? So it's maybe you can talk to the dietitian as well. Especially, looking at your own health, if there are any heart disease like issue, right? It's always better to get professional advice.
So again, Vishnu Swarup says, are there any preventive factors for dementia? I think Rita has already touched on the topic about keeping your brain active by getting involved in as many activities as possible, which will activate different uh, parts of your brain, right?
Right. So if you remember the Lancet study I showed you, that right now we use it as a reference, all of the professionals. So if you're smoking, quitting that. If you are obese, working on that. If you feel you have clinical depression, working on that. Addressing the social isolation, diabetes, managing that well. Physical inactivity is also one risk factor. So see, there is no one factor that can give you dementia. These are percentage wise they have allocated for these factors. Hence, one of the reason you will receive advice to have a good health, good lifestyle is because all of these factors can actually help you delay the onset, right? It's the delay the onset, not prevention. So you want to kind of delay this disease as long as possible, something like what that nun did. The nuns typically stayed in a group. They had this place where they stayed together. They would do a lot of these activities. They always have friends, nuns around. They were physically active, right? So, though she had everything that was needed to have dementia, she fought it. So, our focus will be how do we fight this disease? It's by building the cognitive reserve. lot of research is available. Maybe this time is not enough for us to
Enough to
discuss those.
discuss. Yeah.
Yeah. But a lot is being studied, and definitely you can use Google for that. How I can kind of delay the onset.
Yeah. So exercise, keeping a good social life, having a community of loving, caring people around you, no smoking. Okay, all that. So again, Sudha says any age. What age? So like you rightly said, I think there's no particular age that it starts off.
Correct. So there are even people who have early onset of dementia. So we are talking about young people. And in their cases, they are thoda unique cases in the sense there has been a brain injury, or if they have had, say, Down syndrome, right? So they kind of have early onset. Late onset is related to the age, and then many other factors that we talked about. So basically, at any age, if you kind of working on the lifestyle factors, there is a high likelihood you can delay the onset of dementia.
So yeah, and anyone else who would like to ask questions?
I have actually two questions. One is the role of nutrition and the role of meditation in this particular condition. Nutrition and meditation.
Yeah. So both important, sir, definitely. There are very good amount of research being done even on nutritional factors. And again, this is something, there is no general advice because so see, the fact is close to 60 to 70% of seniors have comorbidity, which means they just don't have one disease. They have dementia, they have diabetes, they have disease, or it could be just physical health issue that someone has mental health issues and diabetes. So one of the reason there is no general guideline for diet is because for diabetes you need to have certain amount of nutrition, different timings. Some do intermittent fasting, some do not advise that, right? So, but nutrition, yes, it plays a great role. And you can again research a lot on that. Maybe Vibha could look into having a nutritionist on the for the session to address these things. So there is no one size fits all, but nutrition plays a great amount of role in overall in your lifestyle. So whatever helps you tackle your diabetes, your heart disease, will definitely is recommended as nutrition. Second part is the meditation. Again, yes, recommended. So someone who has dementia, they can't really do guided meditation because, like I said, they have short-term memory loss, so they have trouble concentrating. Their concentration span is lower. But if others who can do it, they should definitely do it for mindfulness to address the stress, right? And also, especially if you have caregiving duties, we highly recommend that to kind of handle the burnout or the stress you have. So definitely these two things you rightly asked, sir, are extremely important. And no, there is absolutely no doubt about that.
Yeah, I request others also to please ask your questions before we wind up for the evening.
May I ask?
Yes, please go ahead.
Yeah. See, my uncle had this issue, and I mean, it just progressed very, very quickly. He became like a child, and he was, I mean, because he was overeating, lack of exercise, and not listening to anybody, he also tended to become violent. So, is this kind of somebody becoming violent a common thing? And I mean, it's very hard. You really need to lock him inside. He would say that, I want to go out and rush out of the home, may even harm himself in due course, and so on. So I think caregiving can become very, very challenging for the partner or the people in the house. Do you agree with that? I have limited experience with that because he was not in the same city I belong to, so he was far off. But this is something I saw, and then a maid has to help him with everything almost. He was like a child only, going to the
Yeah.
bathroom, having
Yeah.
food, everything, somebody had to help him. But it's a very
Yeah.
scary kind of a disease I felt, and it progressed in no time.
Yeah.
It's like, the family saw that he had this problem, like, they did not even believe that. And then it just suddenly happened when they went for the first checkup, he was declared having this
Yeah.
issue. So I
Yeah.
want to
So
highlight
Amrita,
something
can
about
you,
caring.
yeah. Amrita, can you address that?
Yeah.
So the progress was very fast, is what he's saying.
Yes, in certain cases, it does happen, and that's one of the reason I said average for like how many years a person can live with dementia. There's an average of 12, 13 years. That means it could be 1 year and it could be even 30 years. So in certain cases, yes, progress is faster. It could be because it was not diagnosed on time. It was because it was progressive dementia that the treatment was not kind of, they did not get it in time. There are a number of reasons. No matter what, the awareness is still poor. We delay going to the right medical professionals, right? And what I want to say here is every person with dementia is different. It is lot affected by the personality. So if you take two people with dementia, similar type of dementia, say Alzheimer's, diagnosed at the same time, same age, every factor is same, but still their life history, their personality is different. So they react to certain situations according to that. Okay. This is something I have studied extensively, and probably days are also less for me to address that. But I can assure you that we empower caregivers to work through these difficult situations. So the reason why he wanted to go out, why was that happening? Was there any triggers that were at home? What is it that he wanted to do, right? Lot of these questions could be asked and they could be solved without the use of medication. In fact, antipsychotic drug is not recommended in dementia, right? So there is a lot that could be done to understand the person's point of view when it comes to dementia, empowering caregivers, family caregivers, and the paid professional caregivers both. And yeah, it could look frightening, but trust me, personally, I have seen that it's only because there are the environment is such unintentionally that actually causes these triggers, and then he acts in a certain way. So that's in the shortest way I could tell you that. But if anyone has any questions on the behavioral symptoms, feel free to reach me. We have a lot of sessions planned even in this month. Tomorrow, in fact, we have a senior doctor from the US talking about the brain health. And we personally work with a lot of family caregivers. Even if they're not in Mumbai, online sessions can be done. We have free sessions for family caregivers through the support group. So we genuinely want to help each and everyone who is caring for someone with dementia. So again, I would like to thank Vibha for organizing session on such important topic. And any of her Sukoon Love members need any help, we are happy to help.